Hi, I'm Staci Hix-Hernandez, board-certified plastic surgeon here at Beleza MedSpa. I want to talk a little bit today about my approach to a mommy makeover, and in specific, one element. I like to approach mommy makeovers as an individual compilation of surgeries for each individual patient. Every woman is unique and every pregnancy is unique. Therefore, the problems that are encountered after pregnancy will be different for every patient. I think the most important thing during the consultation is to accurately listen to every patient, their concerns, as well as their long-term outcome goals. That way we can specifically tailor the procedures needed in order to get that patient there. One of the reasons I personally love these procedures is it's important to take care of ourselves, not only as moms, but also as just women. You can eat right, you can exercise, you can do everything in your power to get back where you were before baby, but there are some very specific physiologic changes that happens anatomically that cannot be corrected with diet and exercise alone. So I'm going to draw you some pictures today to illustrate what happens anatomically changing during pregnancy. I like to draw pictures, but remember I went to med school, not art school, so no judging. So if we look at the abdomen before pregnancy, you will see that the rectus abdominis muscles, or our six-pack muscles, are nice and tight and aligned in the midline. During pregnancy, however, something has to give in order to give room for the baby to grow and develop. And what gives is the position of these muscles. So these muscles will actually separate. This is a process called diastasis recti. This layer between your six-pack muscles is called fascia. Fascia is extremely strong, but it's also inert, similar to leather. Once it stretches out, that's pretty much game, set, match. The only way to get these muscles back where you want them is to go back in and sew them back together. This reason right here is why 100 sit-ups a day, eating right, running will never give you that really nice tight abdomen that you had before. In essence, baby untied your internal corset. So a tummy tuck is a procedure that's going to relace up that corset. What I do, in surgery, we are going to make a lower horizontal incision. We also make another incision around the belly button, so the belly button stays attached deep. The skin and the fat is then lifted off of the muscles all the way up to the bottom of the breastbone. It's very important that we see the entire course of these muscles from the very top to the very bottom. Similar to a corset, you want to make sure that the entire thing is laced up. Otherwise, you could also end up with a problem post-operatively. Once we have these muscles completely exposed, then I'm going to go in and literally tie them back together. We are going to tie back up your corset. I do tend to pull a little bit tighter around the belly button. That will encourage the waistline to come back in. If we pull the same straight up and down the whole time, we could end up with a SpongeBob SquarePants situation, which we definitely don't want. Once we get you nice and tight, I'm going to go back and I'm going to do another layer. So you are going to literally be tied up in 2 layers. I want you to feel very secure and very strong with that plication. I don't want you worried that a sit-up or a sneeze or a cough is going to pop and unravel everything. Once we get everything tightened up, then I'm going to take all of that extra skin and typically all of the stretch marks that develop in the lower abdominal wall. I'm going to stretch it down and I'm going to cut off all of the excess. Typically, all of the skin from the lower incision up to where the belly button was will all be removed. So we're going to remove a lot of excess skin in this situation as well. Then we'll start sewing you up. When we are finished, you will have your nice tight abdominal wall again. You will have your six-pack muscles back where they're supposed to be in the midline. You will have a lower horizontal incision, and you will have a new scar around your belly button in its new position. Typically speaking, most patients do not need a drain with this procedure. Occasionally, we will have to leave one based upon your anatomy. You will, however, have to wear a corset on the outside. The compression garment is typically worn for about 4 to 6 weeks after. This is a day surgery procedure. You will come in that morning, have surgery. Typically, you'll be on your way home within an hour or so of surgery. Total recovery time for this is 4 weeks, at which point you'll be able to get back to life as you've known it before, with hopefully a little bit more stamina, a little less fatigue, maybe even a little less back pain. So that is my approach to one of the specific components of a mommy makeover. If you have any questions, I'd love to visit with you in person. Please feel free to visit us on our website at www.belezamedicalspa.com. Thank you.